The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello, and welcome to Health for a Lifetime. We're glad you've joined us, and we hope that today's program will give you health that lasts for a lifetime. And to help us with that is Dr. Kevin Bryant from Wichita, Kansas. Dr. Bryant is a specialist in family practice, and one of his real interests is heart disease. Is that right?
That's correct.
And, you know, we have many traditional approaches to dealing with heart attacks and all of these different types of things. There are lifestyle issues, and there are things that we can do. We can exercise, we can take care of our bodies. But assuming all that's been done, we've looked at those different things. This is really the foundation from which we look at something like our subject for today. Is that right?
That's correct, and it is important to remember that the lifestyle changes are really the most important. What we're going to cover today, while they may be helpful additives, supplements, they don't replace the lifestyle changes that one might need to make. And so it's also important to remember that these herbal preparations, natural remedies, may in fact interact with medications that someone's on. Okay. So it may be important for them to
talk with their physician.
Let them know.
Well, we have an optimistic amount of things we're going to look at today. We want to give an overview of them, but maybe it would be helpful for you to work through what we're going to talk about.
Yeah, we want to look briefly at some of the evidence relating to oat bran, look at vitamins, antioxidants, folic acid, and then two herbal compounds, one called gugu lipid.
Gugu lipid.
I know, it's one
that.
You don't hear about
right.
too often. Certainly most Americans may not have heard of it, but in India it's
big.
Very well known. Hawthorn berry will be the last one that we'll be looking at.
Well, let's jump into it. Let's start off. I mean, some of this, maybe people have heard something about oat bran, but what can you tell us about oat bran?
Well, oat bran may not be big news right now. A number of years ago it certainly was, and the story is told of Dr. Anderson from the University of Kentucky that did the original research, that when he went to get a supply of oat bran, he had marked difficulty even finding it. It had been milled out in the process of producing oat products, and we thought that it wasn't even a useful item. Well, his research has shown us that it can be very helpful in lowering cholesterol. It works by going through the intestinal tract. It's not digested. Bran's not a digestible food item, so it goes right on through. And as it goes through, it attaches to bile salts. Okay. Bile salts are made by the liver and usually are reabsorbed, but when they become attached to bran, oat bran in particular, it's carried on out of the system and thereby takes cholesterol out of the body, and that's how it lowers the cholesterol levels. Normally we talk about at least 2 ounces of oat bran being mixed with food.
So you sprinkle this on your cereal, you do something with it, but get 2 ounces worth, and then it does the magic of taking stuff out.
It goes on through and does its work. And the interesting studies have shown that 10 to 15% decrease in total cholesterol.
That's rather significant. I mean, it seems anyway. What does that mean? If I have my cholesterol that's cut by 10 to 15%, what does that mean in terms of my risk for a heart attack or heart disease?
Well, there are a number of other studies that show us that for every % drop in cholesterol, the drop in heart disease risk is 2 to to 3%. So a 10 to 15% drop can be anywhere from 30 to 45%.
Wow, just by sprinkling that oat bran.
It's amazing, something as simple as that.
You told the story about they didn't even know what it was. Can we find it now in stores? Is it readily available? Could you go down to wherever your local supermarket and say, give me oat bran, and they know what they're talking about?
Well, that is an important point because it needs to be the crude, unprocessed oat bran.
So give me crude, unprocessed oat bran.
Not just simply oatmeal, it's oat bran. So that's an important distinction to be made.
Okay.
You know, that leads into the next thing we want to look at, and that is the area of vitamins and antioxidants.
Okay.
Another item in nature that is recently being found to be very important, and particularly there's two vitamins that are most studied, and that's vitamin E and vitamin C. And they're called antioxidant vitamins. Again, they're the vitamins that help protect our bodies against the harmful effects of what are called free radicals. And these are dangerous byproducts of our own metabolism. Sometimes we get it from the environment, and they can damage our cells. They can.
So they're sort of like an antioxidant is kind of like a molecule that's gone berserk. It's kind of just banging against things and messing things up.
Right, free radicals are, and the antioxidants
calm
scavenge
them
those,
down, or knock them out. So are there free radicals that we can ingest or from the outside, something we eat? There are oxidized things we can eat, and then there are things inside our own body. Is that what you're saying?
Yeah, and one of the major sources in America today of external consumption of free radicals is smoking.
Smoking.
Right. As the cigarette burns and people inhale that smoke, there are an overwhelming number of free radicals in that smoke that then does its damage in our body.
I don't think you're suggesting we could smoke if we take vitamin E or vitamin C, though, right?
No, they've looked at that and found it doesn't protect enough. Yeah.
Oh, okay. So vitamin E, vitamin C, do you just get that in a supplement form, or is it better to take it in a plant source?
There are plant sources for both of those. Obviously, vitamin C is going to be found high in your fruits and a lot of your vegetables. Vitamin E is more in the grains, and some in the nuts. But collectively, in the fruits and vegetables, not only are you getting those antioxidant vitamins C and E, but there are hundreds and thousands of what are called phytochemicals. Phyto is a word that means plant.
Okay.
So plant chemicals, which until just in the last decade or so, we really didn't understand what they were doing. And now we're finding out a lot of them are antioxidants.
They're knocking out those bad guys. So
right.
Is it better, I think what I hear you saying is if you had a choice between getting a plant or eating a banana or eating an apple or eating a strawberry or eating a whatever it is and buying a bottle of the same thing, you're going to get more by eating it nature's way usually than in a bottle because it's just one narrow part of what's in that big strawberry.
Right. You get a combination of them. And it's important to put in, why do we need the antioxidants? What is it that they're doing? And that comes back to the issue of cholesterol and heart disease. And now we know that cholesterol by itself, until it becomes oxidized or damaged by these free radicals, is not nearly as dangerous to promoting heart disease. So it's in an attempt to prevent cholesterol from being damaged by these free radicals that we need the antioxidants.
So God knew what he was doing when he said eat plants, fruits, nuts, grains, and vegetables.
Yeah, he knew there was a tremendous, plentiful supply of antioxidants to help prevent that.
What else do you have for us in your pharmacopoeia of natural remedies?
Well, another vitamin that has been highlighted now just in the last few years is vitamin B, one of the B complex vitamins, folic acid. And where it comes to play is in a new risk factor that's been discovered in the last few years for heart disease, and that's an amino acid called homocysteine. That when that amino acid is at too high a level in our bloodstream, it's been associated with promoting and causing atherosclerosis,
or hardening of the arteries,
which leads to heart disease and other strokes and vascular disease.
Okay, so they can do a lab test and find out whether your homocysteine level is up if you want them to now.
That's true.
Okay, and folic acid acts on that.
Right. Folic acid is an important vitamin needed for our body to take the homocysteine, convert it into another amino acid, which is not dangerous, does not cause the disease process to occur.
So what are there plant sources, or what should we eat for that?
Again, we come back to the fruits and vegetables that are high sources for the vitamin B6, and particularly the legumes, the lentils and the beans are a good source.
So a legume would be what? What's a legume?
A legume is beans and lentils. It's also in a lot of the green leafy vegetables are good sources for it.
Great. So anything else about folic acid you want to share with us?
Well, we were talking about how for every percentage drop of cholesterol, the heart disease risk drops by 2 to 3%. With homocysteine, turns out that for every 1% drop in your homocysteine level, that translates to a 1% decrease in heart disease.
Wow.
And so increasing the folic acid intake by 400 micrograms per day, which if you get several, if someone is getting the 5 to 9 servings
of
fruits and vegetables a day, they'll definitely increase the folic acid level. And that can drop that homocysteine level sometimes 20, 30 to 40%, translating to a 20 to 40% drop in that person's heart disease risk.
So eating, what did you say, 6 to 9 servings of fruits and vegetables a day, you wouldn't have to worry about it. It's not like you have to say, okay, what's my level now? But should they take a supplement to be sure, or what do you think?
Taking a supplement would be fine. I think you're missing out again on all the other good things in those fruits and vegetables.
Okay. So in other words, if you eat the fruits, you get all those thousands of other phyto-plant chemicals that help you.
Right.
Well, why don't we talk a little bit, I think there's another one we want to get to before the break, and just introduce it, L-arginine. What's that all about?
L-arginine is another amino acid, interestingly enough, that is important, and we've just been finding this out in the last few years, that is converted in the body in the cells that line the inside of the artery. It's converted into a substance called nitric oxide.
So that's like that nitroglycerin people take, the little pill or a little squirt, same thing.
That causes those coronary arteries to dilate, to open up.
Blood gets through them better. And we can get this from a plant source?
Right. We can get it from a plant source.
We've been talking with Dr. Kevin Bryant. When we come back, we're going to talk a little bit more about L-arginine and some more natural remedies for your heart. We hope that you join us.
Have you found yourself wishing that you could shed a few pounds? Have you been on a diet for most of your life, but not found anything that will really keep the weight off? If you've answered yes to any of these questions, then we have a solution for you that works. Dr. Hans Deal and Dr. Eileen Ludington have written a marvelous booklet called Reversing Obesity Naturally, and we'd like to send it to you free of charge. Here's a medically sound approach successfully used by thousands who were able to eat more and lose weight permanently without feeling guilty or hungry through lifestyle medicine. Dr. Deal and Dr. Ludington have been featured on 3ABM, and in this booklet, they present a sensible approach to eating, nutrition, and lifestyle changes that can help you prevent heart disease, diabetes, and even cancer. Call or write today for your free copy of Reversing Obesity Naturally and you could be on your way to a healthier, happier you. It's absolutely free of charge, so call or write today.
Welcome back. We've been talking with Dr. Kevin Bryan about heart disease. We've gone beyond normal medications, normal treatment for that. We've been talking about natural remedies for heart disease. Doesn't take the place of those other things the doctor has suggested, but it is very fascinating. It is very helpful. We've talked about oat bran. We've talked about certain vitamins, what was it, E and C. We've talked about
antioxidants,
and then we talked about
folic acid,
L-arginine. Folic acid. Yeah, let's come back to this L-arginine. Anything else you can tell us about it? We've said that it vasodilates, it opens up the blood vessels, and that's what you've shared with us from a natural source, but anything else?
Yeah, Dr. Lehrman reported in the journal Circulation in 1998 that he studied 26 patients who were having chest pain, heart pain, angina pain, but who didn't have blockages that they thought were causing these heart pains. So they determined that these patients' coronary arteries, the arteries supplying blood to the heart, were actually going into a spasm and cutting the circulation off to their heart. He gave these patients L-arginine, 3 grams, 3 times a day, and was able to show that as this was converted into this nitric oxide, it opened their coronary arteries up and increased the circulation 150% in those coronary arteries, and their chest pains went away.
So doubled the amount of flow, or
right.
Just opened it up, just from a natural source. So this is really something we should think about, especially if we have heart disease.
Right. I think it's a natural thing that anyone can do, and there are sources in the plant kingdom for this L-arginine, this amino acid. It can be found in the beans, interestingly enough, in almonds and black walnuts.
Okay.
And in lentils, soybeans, and pumpkin kernels are the highest sources.
Pumpkin pie, okay?
I think it has to be the kernel.
All right.
And so they're a good source. Now, commercially, they do make capsules that have 500 milligrams of it in there. And so L-arginine is a whole new area of research that we're finding can improve coronary blood flow and circulation.
We've got quite a few things in our shopping cart today, natural remedies, but the next one fascinates me. The name is Goo-Goo Lipid. Is that?
Goo-Goo Lipid, yes.
I mean, this is a whole new area. I've never heard of Goo-Goo Lipid before.
If you lived in India, this name would not be so unfamiliar. And in India, this medication is used frequently. It's an herbal medication, but it's prescribed by physicians over in India for the treatment of high cholesterol levels. It's taken from the nuchal myrrh tree. It's the resin of that tree that they extract the compound Goo-Goo Lipid from. Now, it does a number of things.
Some pretty big words here. You're going to have to help us with this.
Right. It does. It slows down the process of putting fat into fat cells.
Okay.
It helps to stop or slow down the liver's production of cholesterol. And this is similar to some of the prescription drugs that are prescribed in America. This is what they do. Cholesterol-lowering drugs do this thing. They suppress the liver's production of cholesterol. It helps to stimulate fat coming out of the fat stores.
Okay.
It also acts kind of like oat bran in binding to bile acids and taking bile acids out of the body, taking cholesterol out of the body. So a number of different ways in which this Goo-Goo Lipid works. Fascinating how it works. Studies, most of the studies have been done in India. There are some that have been done in America. And the well-controlled studies shows that it does all the right things. It lowers the bad cholesterol, LDL, by as much as 17%. It increases the good cholesterol by 14% and lowers triglyceride levels 24%.
Wow. These are significant things. So I think before we were talking that, you know, LDL is the lousy type, and you want that to go down because it's not good for you. That's the type, you correct me if I'm wrong, that goes right into your artery walls and makes them thicken, and you don't want that.
Right. So lowering that is good.
Lowers that. And then the HDL, the happy or the healthy
density lipoprotein.
Those are the ones that take away the bad or whatever.
Take the cholesterol out of the wall of artery, out of the plaques, and so you want that to go up. This is helping elevate that.
And then the triglycerides does something good with those too. That's the fat in the blood that's actually circulating. And that's so different than cholesterol. It's
lowering that.
Okay, it's lowering that. Now there's one problem with this. I mean, look at this name, Gugulipid. I mean, I might feel embarrassed telling someone I'm on Gugulipid. How do I get over that? Maybe there's no way.
Well, just remember the last part of the name, lipid. That's what it's for, is to lower the lipids, the fat and the cholesterol in your bloodstream. And an important thing to bring out at this point is the importance of what are called standardized doses.
Okay.
In Europe and most of the rest of the world, where herbal medications are used considerably more than they are here, prescribed. In fact, in Europe, 90% of the time, physicians prescribe herbal preparations. They do a very good job of making sure that the quality control is there, so that when you read the amount that's on the bottle, that you can be sure it's that amount. America, to this point in time, has not got quite the same process of being sure that everything is standardized. One thing that is helpful when you're looking at an herbal preparation and looking at the ingredients in it, if they say standardized,
that's probably
then
good.
You can feel better that they have the quality control to keep that in there.
I mean, you seem to know a lot about these things. I know that you run a lipid clinic. I know that you follow up these people that go through the health program that you run several times a year, and you look at them on a monthly basis. But how do we find people like you? Let's say that I don't live in Wichita, Kansas, or I'm not near someone like that. How would you go about finding out who it is? You would just ask around, see who has an interest, talk to your physician, see who they know, and try and find someone?
Actually, in the last few years, the area of what's called alternative medicine, herbal medications, has become more and more highlighted in traditional medicine. So our American physician is becoming more aware. And depending on that physician, he may have read more. So talking to your physician, you may find that he has an interest in this area or is willing to at least look into it.
Are there any side effects for Gugulipid?
That's one of the nice things about it. It's very low in side effect. And by and large, most of the herbal preparations are low in side effect. Not all of them, and that's why it's helpful to talk that over with your physician. He can find out some unbiased information about them and find out, do they have possible side effects? Might they interact with some medication you're already on?
Okay. So how often should I take it? Let's say I find the standardized type. I know it's good. How often do they usually take it?
The dosage is considered about 500 milligrams 3 times a day.
Okay. Let's go on to our next one, a hawthorn extract. We've saved a few minutes here. Tell us about this.
Hawthorn berry. Well, this is moving into a different area of heart disease. Today there are over 4.7 million Americans that have congestive heart failure.
That's where the heart gets big, it's not pumping well, it's kind of falling apart.
It's failing as a pump, fluid congests in the lung, the person becomes weak, fatigued, short of breath when they're walking. And in Europe, one of the primary medications used for this is hawthorn berry. we've known for 200 years that digitalis is helpful for congestive heart failure. It used to be called dropsy. So digitalis is actually taken from the flower of the foxglove plant, and it's an herbal preparation. The problem with digitalis is that it can be toxic if you get too much of it, and it doesn't take too much. Hawthornberry, on the other hand, is not as toxic and can be tolerated much better.
So it can do everything that digitalis does well, better.
It can do probably close to as effective as digitalis, but much less toxic. And in Europe, they use it for what's called stage 2 heart failure. There are 4 stages to heart failure, and in stage 2, it would be a milder form of heart failure. So severe heart failure, they don't use it for that. But they have shown that it can increase the heart's ability to contract and pump the blood. And so they use it in Europe frequently either as a first line or sometimes adding it to digitalis. Now, for anyone listening today that is on digitalis or digoxin or lanoxin, you want to be careful about just going out, getting some of this and adding to it without talking to your physician, because it can interact with digitalis sometimes and raise that level. So you need to be working with your physician on this.
So dosage then?
Dosage starts at around 100 and can go up as high as 900 milligrams per day, usually divided throughout the day, 2 or 3 different doses.
Is this really something someone that is not a medical doctor should be doing? I'm thinking through how much they're taking, and I mean, I would feel kind of nervous about that.
In Europe, it's prescribed by the physician,
so the doctors,
controlled by the physician.
And we're going to get there in America, you think? We're moving that way?
I think that we're moving that direction. This Hawthornberry was just highlighted in one of the journals that looks at alternative medications. I think more and more physicians may be becoming aware of its use.
We've been talking with Dr. Kevin Bryant. He's a specialist in family practice. We've been talking about natural remedies for the heart. This is assuming, doctor, that the people that have been with us have been doing all the right things in terms of lifestyle. They've been following through with their physicians. You've given us some really tangible things to think about, some alternatives to try, things that don't have side effects, that have been produced as God would have them. We hope that this has been helpful to you, and that as a result you'll have health that lasts for a lifetime.